I would like to start first with a quote from a philosopher, Martin Hägglund, and I think it's a very well put quote. It says that the light of happiness is always followed by the shadow of loss. Important to remember. I will end later on with a poet, hopefully. I will share my screen here and you will see a few slides. And first of all, I will let you know who has been, or what sort of resources that has been part of this presentation. As mentioned previously, a totally new report has been published today on homelessness in the Nordic countries, written by Hans Svärd, professor here at Lund University, and you can download it here from the Nordic Welfare Organization. The other resource is a research brief that I have written together with colleagues here in Sweden, Ingrid Salin, Arne Christiansen, and Kjell Larsson from the City Mission and also from Fianza. The final one I would like to acknowledge is that we have an ongoing cost action project on measuring homelessness in Europe, and we have a paper almost done that has been written by me, Lars Benjaminsen, and also Evelyn Dyb from Norway. But first and all, we cannot end homelessness without housing, and I think this is a major point. And we can see it clearly when we look at the map of Europe, and it's totally red, and we can see that the housing exclusion and homelessness is rising in most European countries. We have two green countries here, and we will hear more about that later on during the conference, especially Finland and Norway, that has been very successful in reducing the long-term homelessness, which is something we all should strive for. Looking at the numbers on homelessness in the European countries, different figures have been presented from 4 million totally, but the most recent one that has been used is 700,000 homeless people in Europe. Another indicator is that there is about 10 million homes that are empty. So of course there is a mismatch between the number of homeless people and the actual numbers of available housing. Also important here to just mention briefly is that in the Nordic countries, even though we see a lot of similarities in the welfare states and how we have provided for vulnerable groups, there are also very many differences, especially on the housing policies. And Norway stands out as the most home ownership country compared to Denmark and Sweden, for instance. Let's move forward here to just a inverted model of cause and effect. And the reason I want to tell you this is because it's very easy that when we talk about, for instance, homelessness as a social problem, it's very easy that we start to study those people that are affected by homelessness, and we discover differences between people that are being homeless and others, and we tend to see those differences as causes of the social problem. And then we try to create solutions that can correct these identified problems. But in many ways, we actually attack the symptoms rather than the root causes of homelessness. So it's important to acknowledge that an inverted model of cause and effect is actually a challenge for all of us. We often see three perspectives when looking at both homeless versus research, but also how countries perceive homelessness. And the first one is more individually based on causes of homelessness, that people have different types of problems or situations that makes them homeless. A second perspective focuses more on structural causes. And you can say that for instance, the housing market. And when I entered the field of homelessness research in the early 2000s, it was still a big conflict between these two perspectives on individualistic perspectives and structural perspectives. But more recently, a third perspective has become more predominant, and that's a mix between many of these different factors, from structural to individual and organizational, and we tend to put them on 4 different levels, from structural, organizational, institutional to relational and individual level. Hope I don't speak too quickly, but on the top here, this is unfortunately in Swedish, but hopefully you can understand something. Otherwise, I will let you know. On the top there, you can see that poverty and the lack of housing is key drivers to homelessness. And in the box, it's the organizational field. In that box, we have people living within housing, but could be a potential homelessness population because of their maybe losing a job or something else. They might risk not being able to pay the rent. And as the introduction were telling us about the preventative work, it's very important to prevent people from being homeless before finding solutions in making people getting back into the housing market. But while we have a homeless population, or people experience homelessness, we can see that they in different countries are dealt with differently. So in Sweden, for instance, we have something called the secondary housing market to the left and the lodging market to the right. And the secondary housing market is not something you find in the other Nordic countries, but that's ordinary housing spread out in the ordinary housing stock, but you live with a contract that the social services provide. So within the homelessness population, we normally talk about 3 different groups. One group that exits homelessness, they enter homelessness quickly and exit it quickly too. Another group is more cyclical. They come back and forth over the years. And one in America they call chronic homelessness, but we prefer to talk about long-term homelessness just to show that it's not a determinant. It's very possible to actually end homelessness even if you have been homeless for long term. So looking at this picture is the 4 different levels, from the structural to the institutional. We have different practices, different institutional way of working, to the relational, where, for instance, divorce or addiction and other things can come in to, and also to the individual level. Moving on, the definition of homelessness, even though there are similarities between the Nordic countries, we can also see a lot of differences. But 4 conceptual categories can be of interest: roofless, living on the street; houseless, living within some sort of housing, but not on the streets. And insecure housing could be referred to the secondary housing market in Sweden, for instance. You have a place to stay, but your contract is not as secure. And the inadequate housing is another category where you might live in a housing that is not very good for you, not health way or other ways. So from these 4 conceptual categories, we have many other different types, and all the Norway, Denmark, and Sweden has used some of these concepts from the ethos, European typology of homelessness and housing exclusion, in our national categories. But we will see here that it's not so easy when we compare. For most, a lot of people at least still tend to think about homelessness as rough sleeping. But looking at the way we define in the different countries, we can see that some people that actually live on the streets are not seen as homeless people, or people experience homelessness, because they are excluded from the definitions. While people living in the secondary housing market in Sweden are defined as homeless, even though they have an apartment. So this is very important to bring into the discussion here, that the way we categorize will have consequences, but the actual situation of a person might differ from the way we define their situation. Even though it's totally difficult to make comparisons, we can still use those numbers that we have. And looking at them, you can see that me being from Sweden, I can just say that we are not the best in class, best in school. And that's unfortunately not so positive, but looking at the figures here in the right column, you can see that the number of homeless inhabitants in Sweden is 3.3 out of 1,000 inhabitants. And if you take away the secondary housing market, we end up on 1.7, still more than all the other countries. And Finland and Norway has done a very good job, even though we know that Finland has more recent numbers, and also Norway is on its way with a new count. So we'll have a look at that in a short while. It was also mentioned here in the beginning about Housing First, but you can say, I will not go into detail here, but you can say that the main difference between the two models, staircase model and Housing First, is that within the staircase model, housing is seen as the end goal. You move in step by step in different types of housing provided for homeless people, or people who experience homelessness, from a night shelter to a category of housing or training housing, and then you move on and show that you're housing ready in order to take over your own apartment at the end. Housing First, on the other hand, is in that model, housing is the means. So that means that housing is seen as a precondition in order to take care of other issues that you might have to deal with in your life. And looking at the evidence, both internationally and in the Nordic countries here, the evidence for Housing First is very strong compared to what we see in the staircase model. The problem with the staircase model is often what we say about the uncertainty, especially for the person living, not knowing when the person is able to move on to the next step, what is required to move to the next step. And many times you can say that a lot of those housing that is available within a staircase model, it becomes a problem for the social services to find people and match them to the housing available. And sometimes it's more about having a place available rather than a suitable place for a specific person. We also see a tendency here towards moral assumptions on homeless persons being in a homeless situation. So it's about putting the responsibility on the person, on the individual, and not really looking at the structural causes that has been involved, but also founding a base, putting the base of the model in coercive measures and control, and looking at how the research has shown that the most effective way of working is actually to listen to what the individual wants and needs in order to progress, but also take in the experts by experience view when we design and construct interventions for homelessness. Housing First is also based on 8 key core perspectives, and those are very much possible to reuse in other contexts too. And the founding concept there is actually looking at housing as a human right, and I think that's also very interesting to bring in. Another thing that I think talking about homelessness in the Nordic countries on a national level is also complicated, because if you look at individual countries, you see a big difference in the regions from different municipalities, both of the resources that they have available, but also the target group, and also how they work and the context, how, for instance, how in tune is the municipality with concepts like harm reduction or recovery. And there can be sometimes very strong resistance to some of these perspectives that actually show strong evidence in research. So at the end here, I would like to talk a little bit about what needs to be done. And sometimes it's, of course, like kicking in open doors, because we know that in order to end homelessness, we need to build more housing, and housing that is actually available for the people that needs them. Because especially in Sweden, has been totally deregulated and is now seen as one of the most liberalized and deregulated housing market in the Western world. And of course, when the housing prices are increasing and the rental flats are decreasing, it's very difficult to become a consumer on the housing market. Looking at the evidence, but also the experiences from countries like Finland, you will hear more about those in another session here with Juha Kakinen, for instance, and also Norway, and also international research. It's very important when constructing a new strategy that it's an integrated homelessness strategy with housing as a human right as a core. And also with the integrated homelessness, that means that it's not only a top-down, but all levels are involved in preventing homelessness. And you see the next point there is prevention. And I think some challenges still exist when it comes to when do we use prevention. In Sweden, sometimes the preventative work is connected to being also within the secondary housing market, for instance. So I think prevention needs to be addressed clearly to people that are not already clients to the social services. And here, of course, we see poverty as a real challenge. Still, I think Sweden stands out there in the Nordic countries, and it's looking more like the UK, where poverty becomes one of the more prominent factors or causes to homelessness even here. And also a growing group of the homelessness population that have a migrant background, and also increasing population that are women and women with children. As said before, I think very important is to actually base our intervention on those that we either call evidence-based method or knowledge-based method, because it's a lot of the things we have done so far, we have done without knowing if it's good or not, but we do it from a goodwill. And that is to say, when it comes to faith-based organizations and NGOs, that even though soup kitchens and shelters can be very positive in an acute situation and important in an acute situation, sometimes some of these methods or way of working also keep the homelessness organization and situation growing and continuing. So it doesn't sort of stop the root causes of homelessness. Unfortunately, child perspective is lacking very often in Sweden and also in other Nordic countries. We don't really see the child. We ask the parents about things, but we don't really talk to the children. And if we talk to the children, maybe we talk to them in not so good ways. So we really need to raise the awareness of taking on the children's perspective. And one reason for this is that we know that a year in a child's life is a lot longer than a year in my life. So if we let kids move on and live in a homelessness situation for a long time, that can cause some real problems, not only for the child, but for society. We have an ongoing pandemic and COVID-19, but it has really put the focus on and elucidated that our communities, our societies are not sustainable and not very resilient. Two concepts here is stay home, which is not possible if you don't have a home. And the other one is the shared air. And a lot of the homelessness intervention has been shared air solutions. So what I would like to say is we should not focus on creating more durable short-sightedness. That means that we do short acute solutions that tend to be long-term. And we should not create strategies that make the unwanted visible invisible. That means that we shouldn't have strategies that exclude people from the public space. Instead, we need to integrate people and care for each other. And I will end with a quote from a poet, Christian Lundberg, a Swedish poet, because he said that sometimes when life is really difficult and hard, you don't have the strength to carry your own shadow. And when that's the case, when we don't have that strength, that's the time when society needs to step in, our communities and we as fellow citizens, to make sure that the person stops falling down. Thank you very much for this session.